would say that in the last 1 to 2 weeks we have seen an uptick in the number of influenza cases, and they come in with high fevers and coughs, but also with pneumonias. We also have patients in the ICUs who have influenza, so we are definitely seeing the more serious cases in the hospital with influenza. These are H1N1 2009 cases, but also H3N2 and B. So all of the seasonal influenza strains are being seen. This is one of our peak seasons for influenza and respiratory infections. This year, the H1N1 vaccine is now just part of the regular seasonal vaccine. The Southern Hemisphere vaccine has just been released in late April, so we are using it now. And the Southern Hemisphere vaccine has 3 strains in it, and it will be the same one as for the upcoming Northern Hemisphere vaccine coming out. So if you get it now, it will last you for a year. It's cheaper than the pandemic flu vaccine when it came out, so you get a lot of good value. It's 3 in 1. People who didn't get the H1N1 last year because they were worried about the side effects, now that it's just part of the seasonal regular flu vaccine, should go ahead and get it if they want to prevent flu. And certainly anyone with high-risk conditions, people with lung problems, asthma, people who we think have a higher risk for H1N1 with obesity, for example, people with chronic heart problems, people with malignancies, people with suppressed immune systems, everyone over 65. These are all the normal people that we would recommend for flu vaccine. And it would reduce probably a lot of the cases that we might be seeing in hospital if we can reduce just the overall number of influenza cases. We'd see fewer complications in the hospitals, and the hospitals are pretty full. So this is preventable potentially.